Welcome to the Dental Pro Tech Talk, the ultimate show for dental professionals staying on the cutting edge of dentistry and technology. Join us as we explore the latest advancements in dental tools and techniques, from soft tissue diode lasers and teeth whitening to imaging breakthroughs and beyond. We're here to help you future-proof your practice and deliver exceptional patient care. Whether you're a dentist or hygienist, this podcast is your go-to resource for tips, growth, and all things tech.
Welcome back, everyone. Today we're going to be taking a deep dive into surgical diode lasers in dentistry.
Oh, yeah.
I know this is a topic that's really relevant to all of you, especially those of you who are practicing dental professionals.
Yeah.
And for this deep dive, we have a really fantastic guy, Dr. Timothy Kaczynski.
He is a legend.
Yeah, he is absolutely a legend in the field. He's placed, get this, over 18,000 dental implants.
Wow.
And he's published over 240 articles.
That's amazing.
I know. And he also holds a mastership in biochemistry.
Oh, wow.
So we're really excited to have his expertise on the show today. We're going to be talking about a recent webinar that he gave specifically on diode lasers. And it's just packed with real-world examples and tips.
Yeah.
So yeah, let's dive right in. I think one of the first things that, anyone who's considering using diode lasers is going to want to know is like, okay, why diode lasers? Why should I even bother with this? So what does Dr. Kaczynski say about that? What are some of the advantages that he highlights?
Yeah. Well, right off the bat, you can tell in the webinar that he is so incredibly passionate about diode lasers.
Oh,
and how they've completely revolutionized his practice. But what's really interesting is he doesn't just talk about the clinical advantages. Like, of course there are those, but he talks about how they impact his daily practice, seeing more patients, improving patient comfort, getting better results, all while saving chair time.
Yeah, time. That's some music to any dentist's ears, right?
Sure.
Like, time is our most valuable resource.
Exactly.
So anything we could do to save time,
Yeah.
is going to be a huge benefit.
Totally. And, he even talks about those everyday hassles that we all deal with when it comes to soft tissue management.
Oh my gosh.
Like retraction cords and bleeding and patient discomfort, all those things. Diode lasers, he says, offer a real practical solution to these problems.
Yeah. That's awesome. So let's get specific. What are some examples of how he uses it in his practice?
Well, he goes through a whole range of applications, from simple to very complex.
Yep.
One thing he talks about is laser troughing, and he really believes it's a game changer, especially for those embracing digital dentistry.
Now, I have to admit, I've heard the term, but I haven't really dived into it. So what exactly is laser troughing?
Yeah, so think about how we've traditionally managed gingival tissue for impressions, right? We've got those double retraction cords.
Oh, yeah.
And the bleeding and the time it takes to pack them. Laser troughing allows you to create a clean trough around the tooth in seconds. You get minimal bleeding.
Oh, wow.
And it ensures a clear view of the margins, so you can get a precise impression.
So it's really all about precision and efficiency.
Exactly.
Okay.
And it works whether you're using an analog or a digital workflow. He really stresses, though, the importance of using the correct power settings and maintaining continuous movement with the laser tip.
So there is a learning curve, right? You can't just pick it up and be an expert.
Right. You're absolutely right. He strongly recommends taking hands-on courses, and he really emphasizes that mastering the diode laser takes practice, just like any other dental skill.
Yeah, for sure. You gotta know what you're doing with it.
Right. And, you need to learn how to adjust the power settings for different tissue types and different procedures to avoid things like tissue charring.
Yeah, okay. So that makes sense. Now, speaking of different procedures, he also talks about using diode lasers for gingivectomies and tissue contouring.
Yes.
So it's not just for implants.
He even shows a case where he uses the laser for minor contouring on a patient's natural teeth.
Okay.
To kind of refine the gum line and create a more harmonious smile.
Oh.
And what's really remarkable is that the diode laser allows for such precise and controlled tissue removal that he often performs these procedures without anesthetic.
Wow.
So you get minimal bleeding, minimal discomfort, and faster healing times.
So no anesthetic for a gingivectomy. That's pretty amazing. What about frenulectomies?
Right.
Those can be tricky, especially with kids. So I'm curious how the laser changes that procedure.
Well, he describes how diode lasers have transformed this once dreaded procedure into a quick, often painless experience,
Nice.
and sometimes even without anesthesia.
Wow.
He shares a story about a hygienist who was tongue-tied and how a laser frenectomy was life-changing for her.
Wow. I can only imagine the stress of like trying to wrangle a scared child while performing a frenectomy with a scalpel. The laser seems like it would make a huge difference there.
Oh, absolutely. And he emphasizes the importance of clear communication and building rapport with patients, especially children,
Right.
to make the experience as positive as possible.
Okay, so it's a combination of the right technology and the right approach.
Totally.
Now, speaking of changing the game, let's talk about implant dentistry.
Mm.
How does he use diode lasers in that realm?
This is where his experience really shines through, I think. He walks through various implant procedures,
Oh.
from uncovering to peri-implantitis treatment, and highlights how the laser makes each step more efficient and predictable.
So one thing that's always on my mind during implant uncovering is controlling bleeding.
Yeah.
Especially with patients on blood thinners.
Right.
So how does the laser factor into that?
Well, that's a critical point, and he addresses it directly. He demonstrates how he uses the laser to uncover implants with minimal bleeding, which allows him to take impressions immediately.
Okay.
And he often doesn't even need anesthesia.
That's great.
Especially, this is especially helpful for patients on blood thinners like Eliquis.
That's a game changer for those patients.
Hmm.
No more stressing about medication interactions or, that increased bleeding risk.
Absolutely. And
Yeah.
because the laser promotes hemostasis, he's often able to move patients directly from hygiene to same-day restorative procedures. So talk about efficiency.
Yeah. It sounds like he's created a really seamless workflow, from hygiene to final restoration, all in one smooth visit.
He really has. It's impressive.
And he credits a lot of that efficiency to the diode laser.
He says he wouldn't practice without one.
Now let's talk about peri-implantitis. This is a condition that can threaten the longevity of implants, and it's something I know a lot of dentists are concerned about. So how does he approach this with the laser?
Well, he's very clear that the laser isn't a magic bullet,
Right.
but it is a valuable tool.
Okay.
He uses it to debride the infected area, promote healing, encourage bone regeneration. He really emphasizes the importance of a thorough diagnosis
Right.
and a multifaceted approach to treatment.
Mm-hmm.
But in his experience, the laser has helped him manage and even save ailing implants.
That's reassuring to hear. It's good to know there are options out there for managing this condition.
Right. And it's not just about treating problems. He also highlights the use of the diode laser for biostimulation.
Biostimulation, that sounds intriguing.
Yeah.
What exactly is it, and how does he use it in his practice?
So it's also known as photobiomodulation.
Okay.
And it involves using low-level laser therapy to stimulate cellular processes and promote tissue regeneration. He uses it to treat things like canker sores, cold sores, even to reduce tooth sensitivity.
Well, you can treat canker sores with a laser
Yeah,
without even touching them.
that's right.
How does that even work? I get those all the time, and the traditional treatments are, well, not very fun.
He demonstrates how he uses the laser to deliver a non-thermal dose of light energy to the affected area. And this stimulates blood flow, it reduces inflammation, and it speeds up the healing process. He shows some pretty amazing before and after photos of patients with cold sores, showing how quickly the lesions resolve with laser biostimulation.
Okay, I'm officially intrigued. What about tooth sensitivity? How does the laser help with that?
Well, he explains that it helps to seal dentinal tubules by stimulating cellular activity and promoting healing.
Okay.
And he says the results are often immediate and can last for up to a year.
Oh, wow. That's pretty remarkable.
It really is.
So it really sounds like a multi-tool. It's not just about surgery and cutting, but it's also about these therapeutic applications as well.
Exactly. And it's clear from his presentation that he believes biostimulation is a powerful tool with a wide range of applications and an area that's really ripe for further exploration. The webinar actually sparked a ton of questions from the audience about this and other laser techniques.
Well, let's dive into those questions.
Yeah.
I'm sure our listeners are just as curious as the webinar attendees were.
Yeah, let's do it. We'll start with some of the most common concerns and then get into the more specific applications.
All right, let's do it. Okay, so let's jump into the Q&A portion of the webinar. This is where things get really interesting.
Yeah.
We get to hear Dr. Kaczynski's thoughts on some specific challenges and applications.
Absolutely. And the audience, they really came prepared with some great questions, which is a testament to how much interest there is in this technology.
Yeah,
One of the first things that came up was fees,
of course. Yeah.
a very practical concern
Yeah.
for any dentist considering incorporating a new technology.
That's the million-dollar question, right?
Yeah.
How much can you realistically charge
Right.
for laser procedures?
Well, he kind of jokes that he's not the best with fees. His daughter actually handles that side of the practice.
Okay.
But he does offer some insights into his approach. For example, for procedures like laser troughing, where the laser is simply enhancing efficiency, he doesn't charge an additional fee. It's
Right.
just factored into the overall cost of the crown.
So he's saving time, improving the outcome. So it's a value add for both him and the patient.
Exactly. But for procedures like, laser bacterial reduction or treatment of a herpetic lesion, he does charge a specific fee.
Okay.
And he also mentions that the Academy of Laser Dentistry is a good resource for fee information.
That's good to know.
Yeah.
The ALD, is an excellent resource for anyone interested in learning more about lasers in dentistry.
Yeah.
Speaking of learning, one attendee asked a question that I'm sure is on the minds of a lot of dentists. Is a diode laser a good starting point for someone who's new to laser technology?
He believes it is a great fit for beginners.
Yeah.
They're relatively affordable.
Yeah.
And they offer a wide range of applications that can benefit really any dental practice.
Okay.
He even specifically mentions they're great for treating kids.
Yeah.
Which makes sense considering they're minimally invasive.
Yeah.
So yeah, no need to jump in the deep end with the most expensive laser right away.
Right. Start with something simple, get comfortable with it, and then as your practice grows, you can maybe expand your capabilities.
Exactly. But of course, he still emphasizes the importance of hands-on training to master any new tool, no matter how simple it might seem.
Yeah, of course. Speaking of hands-on experience, another attendee asked about hygienist use of lasers. Specifically, is there a resource that outlines what procedures hygienists can perform with a laser in each state?
Right, because the regulations vary so much.
So much, yeah.
Yeah. Dr. Graber, the webinar moderator, actually jumps in to answer this one.
Okay.
And he mentions that the ALD is working on publishing a state-by-state breakdown of hygienist laser usage
Oh, wow.
on their website.
Okay.
So it sounds like a fantastic resource for hygienists looking to incorporate lasers into their practice.
Yeah, I think a lot of hygienists are going to appreciate that clarity.
Yeah.
Now, moving back to implants, one attendee asked, how do you remember exactly where the implant cover screw is when you're ready to uncover it? I mean, it seems like a simple question, but it's a practical consideration.
Yeah. He recommends using a periapical probe to locate the screw, maybe taking an X-ray for precise visualization, even using a surgical guide for guided surgery cases.
So you're not just eyeballing it. You got to be a little bit more strategic, yeah.
Right, you really do.
Yeah.
And, in more complex cases, he might reflect the tissue
Okay.
to ensure clearer visualization before uncovering the implant. Better to be safe than sorry, especially when it comes to implants. Another important point that came up was the need for protective eyewear.
Oh, absolutely. Not just for the dentist, but for the staff and the patient as well.
Exactly, and he emphasizes that. He even mentions that there are special shields that can be attached to dental loops for added protection.
Oh, wow. I love that there are products out there that make it so easy to prioritize safety, without compromising on visibility.
Right, exactly. Now, this next question sparked a lot of discussion. The use of diode lasers for TMD treatment.
Ooh, interesting.
Yeah, it is an area that's getting more attention these days.
Mm-hmm.
While he doesn't personally use lasers for TMD treatment, Dr. Graber shares his experience with this application. He explains that certain diode lasers, used without a tip, can effectively treat pain and trismus associated with TMD.
Interesting. So again, it just highlights the versatility of this technology. It's not just for cutting tissue, but it also has these therapeutic applications.
It really does. And he encourages attendees to explore this further, especially since it's a topic that's often covered at ALD meetings. It sounds like there's a lot of potential there.
Yeah.
But, more research is needed.
Of course, yeah.
Yeah.
Speaking of research, someone asked about using the diode laser for desensitizing teeth.
Right, yeah.
Another interesting application.
Oh, another one. And he uses biostimulation for this, similar to the technique he described for treating canker sores and cold sores. He applies fluoride to the sensitive area and then uses the laser to stimulate the dentinal tubules, effectively sealing them and reducing sensitivity.
Okay, so that's interesting. So you're kind of combining the fluoride with the laser to get this desensitizing effect.
Exactly.
That's pretty amazing. Imagine being able to offer patients like long-lasting relief from tooth sensitivity with like a quick and painless laser treatment.
It could be a real practice builder.
Yeah, I like it. All right, so before we get too carried away talking about all the amazing things lasers can do, let's address some of the concerns that came up in the Q&A. Started with the big one, electrosurgery around implants.
Right.
I was wondering when that would come up.
Yeah.
I mean, it's something we all learn in school. Electrosurgery and implants don't mix. It's a recipe for disaster.
Exactly. Both Dr. Kaczynski and Dr. Graber are very clear about that. Electrosurgery is a thing of the past,
Yeah.
especially when it comes to implants. The risk of damage is just too high.
So it's amazing how technology evolves, right? What was once considered cutting edge is now obsolete.
Yeah, it really is. And speaking of potentially outdated techniques, someone asked about using chlorhexidine for post-operative disinfection.
Is it still the gold standard?
Right, yeah, that's a good question. I still use chlorhexidine routinely, but, I'm always open to learning about new options.
Well, he reveals that chlorhexidine is actually falling out of favor in the literature.
Oh, wow.
Recent research suggests that its antimicrobial benefits might be outweighed by its potential to actually hinder tissue healing.
Really? That's interesting. I hadn't heard that.
Yeah, it's pretty interesting. So he switched to a brand called Perioscience for post-operative care.
Okay.
But he does emphasize that the research on chlorhexidine is evolving.
Mm-hmm.
And so, he encourages everyone to stay updated on the latest findings.
Good reminder to never stop learning,
Yeah.
especially in a field that's constantly evolving like dentistry.
Right.
Okay, so this next question's a little bit more lighthearted. What was his favorite experience with a patient using a laser?
Well, he tells a really heartwarming story about a hygienist who was tongue-tied.
Aw,
And, he performed a laser frenectomy, and she was just amazed by the minimal discomfort. Yeah.
and the immediate improvement in her tongue mobility, it was truly life-changing for her.
That's so great. It's those kinds of patient experiences that make dentistry so rewarding, to be able to make a real difference in people's lives. A privilege.
Yeah.
Yeah. He also mentions that he really enjoys treating kids with lasers as the experience is often much less traumatic for them
Yeah.
and for their parents.
Oh, yeah, of course. Anything that makes a dental visit less stressful for a child is a win in my book.
Totally.
Okay, back to some of the concerns. One attendee asked about the risk of a laser tip fracturing off into a periodontal pocket.
Ooh.
I have to admit, that's something that's crossed my mind, too.
Yeah, this sounds scary. But he assures us that it's highly unlikely.
Okay.
The tips are disposable and designed for gentle use, not forceful pressure. So as long as you're using proper technique, there's minimal risk of a tip breaking.
That's reassuring.
Yeah.
But it does
Yeah.
highlight the importance of proper training, right? You got to know what you're doing. You really do. Speaking of knowing what you're doing, here's a question that's probably on many dentists' minds. Can a diode laser be used to stop bleeding from bone during a surgical extraction?
Oh, yeah. Managing bleeding during extractions can be a real challenge, especially with certain patients.
Well, he admits that he hasn't personally used the laser for this specific purpose,
Okay.
but he speculates that it could be effective in coagulating smaller vessels.
Okay.
Dr. Greger adds that while you can't coagulate a vessel larger than the laser tip size, there is a growing interest in using the diode laser in a non-contact mode
Okay.
to initiate coagulation as the socket fills with blood.
Interesting.
Yeah,
So not a magic bullet for major bleeding, but potentially helpful for those smaller vessels.
exactly.
Okay, that makes sense. So this next question is about a scenario that I think many of us have encountered. How to handle hyperplastic tissue around implants.
Right.
What do you do?
He is very confident in his approach here. He uses the diode laser to excise the hyperplastic tissue, often without even needing anesthesia.
And he shows some pretty impressive before and after photos of a case where he used the laser to remove excess tissue around healing abutments.
I've definitely had cases where the tissue overgrowth was so significant that it, interfered with seeding the final restoration. So it sounds like the laser could be a really helpful tool in those situations.
It absolutely can be. And he emphasizes that it's not a race. Patience and precision are key. He even compares it to using a pen,
Oh, wow.
carefully sculpting the tissue
Okay.
to achieve the desired outcome.
It's all about that finesse.
It is.
Okay, here's a question that's particularly relevant for those practicing in states with stricter regulations. Is there a special license or certification needed to use a diode laser in a dental office? That's a concern for a lot of dentists, I'm sure.
Right. He believes that in most states, a specific license isn't required to operate a diode laser.
Okay.
However, he strongly emphasizes seeking out continuing education and training.
To become proficient with the technology. He also highlights the value of joining organizations like the ALD.
Good advice. Staying informed and connected with other professionals is so crucial, especially with these new technologies.
Right. And Dr. Graber adds that some states do require dentists who have hygienists using lasers to be equally qualified.
Oh, okay.
He also mentions that the ALD offers certification programs for those who need it. So always good to check your state's specific regulations.
Yeah, absolutely. All right, let's move on to a question about Class 5 restorations. Do you need to anesthetize at all, or can you just use the laser and restore without numbing? That would be amazing if you could skip the anesthesia altogether.
Yeah. He clarifies that those are two separate issues. So the laser is primarily used for soft tissue management, right?
Right.
And he often performs those procedures with minimal or no anesthesia. However, if the tooth itself requires preparation, then anesthesia might be necessary.
So the laser doesn't magically numb the tooth.
No.
It's about managing the soft tissue aspect.
Exactly.
Okay, got it. Now here's a question that piqued my curiosity. Can the diode laser be used to remove hyperplastic tissue for biopsy?
Yeah.
You know, it would be convenient to collect the sample during the procedure.
Right. He acknowledges that it depends on the specific lesion.
Okay.
For routine hyperplastic tissue, he doesn't typically send samples for biopsy.
Okay.
But if there's any concern, he consults with his oral surgeon.
Yeah. Always good to have a specialist on speed dial,
Exactly.
especially when it comes to something as important as a biopsy. Speaking of collaboration, one attendee asked about decontamination steps when treating peri-implantitis. How do you ensure that the area is thoroughly cleaned before using the laser? It's a crucial step in the treatment process.
Yeah. He admits that treating peri-implantitis can be challenging and there's no, one-size-fits-all approach.
No.
But he emphasizes the importance of mechanical debridement and thorough cleaning before using the laser to decontaminate the area and promote healing. He also mentions that in cases of, significant bone loss, he might opt to just remove the implant altogether,
Okay.
allow the site to heal, and then place a new implant.
So sometimes it's better to just start fresh than to try to salvage a failing implant.
Exactly. It's about making the best decision for the patient's long-term health.
Right, right. Now, here's a question that really highlights that non-invasive nature of laser therapy. How long do you apply the laser to a canker sore lesion? I'm guessing it's a pretty quick process.
Well, it's a bit more involved than, a quick zap.
Okay.
But he explains that he typically applies the laser for about 20 seconds per session, repeating the process 3 times for a total treatment time of around a minute. And remember, you're not actually touching the lesion. The laser is held a short distance away, delivering a gentle dose of light energy.
Okay, so it's not about like burning the lesion away, but rather stimulating the body's natural healing process.
Here's a question that's particularly relevant for those working in the aesthetic zone. Would a flap procedure preserve more tissue than laser excision? Tissue preservation is always a key consideration.
It really is, especially in the anterior region.
Absolutely, yeah. You want to maintain as much healthy tissue as possible, especially around implants in the anterior.
Right. He explains that the laser allows him to make a very precise and minimally invasive incision,
Okay.
preserving as much tissue as possible. He prefers a more conservative approach, aiming to maintain a band of attached gingiva on the facial aspect of the implant.
Yeah, less is more when it comes to surgery, right?
Right.
Especially when aesthetics are paramount.
Exactly.
Okay, here's a question about coding. Is there an ADA code for laser-assisted periodontal therapy? Very practical question for any dentist incorporating lasers into their practice.
Right. Got to make sure you get reimbursed for your work. Exactly. Yeah.
Yeah.
Unfortunately, Dr. Graber doesn't have a definitive answer on that specific code. He mentions that the upcoming webinar will focus on coding and how to maximize reimbursement for laser procedures. So something to look forward to.
Yeah. It's a good reminder that staying updated on coding is essential for any dental practice, especially as new technologies and procedures emerge.
Absolutely. And speaking of new technologies, this next question is about a challenge that many dentists face. What's the best way to manage bleeding during implant uncovering, especially for patients on blood thinners?
It's a tricky situation for sure. It can be stressful for both the dentist and the patient.
It can. He emphasizes using the laser to achieve hemostasis before taking impressions.
Okay.
He also mentions that in some cases he might use a combination of techniques, such as a tissue punch followed by laser coagulation, to control bleeding.
Okay, so it's really about being adaptable.
Yeah.
Finding the best approach for each individual patient. That's the art of dentistry, right?
Oh.
Absolutely. Now, here's a question about a specific case. A patient presents with a large traumatic ulcer on the side of their tongue.
Hmm.
The dentist prescribed magic mouthwash and chlorhexidine, but they also have a soft tissue laser. How could they have approached this situation with the diode laser?
Yeah, that's a great question. I'm sure a lot of us have encountered similar situations. What does he recommend?
He suggests using the laser for biostimulation in this scenario.
Okay.
He emphasizes that you wouldn't want to touch the lesion directly,
Right.
but rather hold the laser a short distance away to deliver a dose of, healing light energy.
Okay.
He uses a circular motion, extending slightly beyond the borders of the lesion to promote circulation, reduce bacteria, and accelerate healing.
So it sounds like a gentler and potentially more effective approach than just relying solely on mouthwashes.
Right. It's good to have multiple tools in your arsenal.
Yeah, for sure. Here's a question from a hygienist. What are the typical post-operative instructions for a frenectomy performed with a diode laser? I'm assuming they're probably a little bit different than traditional frenectomy instructions.
They are. He reveals that he actually gives very minimal postoperative instructions.
Oh, wow.
For laser frenectomies. He explains that because there's minimal bleeding and tissue trauma, patients typically experience very little discomfort
Okay.
and require very little special care.
Oh, that's great. Huge benefit for both the patient and the clinician,
Mhm.
Less post-op hassle means happier patients.
Right.
Less time spent on follow-up care. So,
That's awesome. Absolutely. We've covered a lot of ground in this Q&A.
yeah, we have.
And we've got some really interesting questions to wrap up with.
Yeah, let's dive in. So, this first one is all about power settings.
A crucial aspect of using any laser.
Absolutely.
Yeah.
And I imagine using the wrong setting could have, some not so great results.
Definitely. And he emphasizes that selecting the right power setting isn't a one-size-fits-all approach. It really depends on the specific procedure, the patient's tissue type. Even their pigmentation can play a role.
Okay, that makes sense. Different tissues are going to react differently to that energy, right?
Exactly. So he mentions, for example, that darker pigmented tissue might require a little less energy,
Okay.
while lighter pigmented tissue might need a little bit more power to achieve the same effect. He stresses the importance of paying close attention to the tissue response during the procedure.
Okay.
So if you see any charring, that's a clear sign that you need to adjust the power down.
Okay, so you really need to be observant and adjust your technique based on what you're seeing happening in real time.
Exactly. It's like any other dental procedure in that way.
Right. Speaking of potential complications, one attendee brought up a concern that I think a lot of dentists probably share, which is using a diode laser around amalgam fillings or PFM crowns.
Yeah, a valid concern.
Yeah.
And he advises against using the laser directly on those restorations, as that heat generated could potentially damage them.
Okay, so best to err on the side of caution in those situations.
Right. And it just highlights the importance of, understanding those laser tissue interactions, knowing when it's appropriate and when it's not to use a laser.
Yeah. Now, this next one is interesting. One attendee asked about using diode lasers in patients who have undergone radiation treatment for head and neck cancer.
Yeah, that's a situation where you definitely want to be extra cautious.
For sure.
Yeah. And he mentions that he hasn't really encountered any specific contraindications in the literature regarding laser use in those patients.
Okay.
But he does acknowledge that it's important to consider their medical history
Right.
and proceed with caution.
That makes sense. I mean, every patient's different, and their medical history plays a huge role in how we approach any treatment.
Exactly. Open communication with the patient and reviewing their records.
Yeah, absolutely. Okay, so before we wrap things up, I want to touch on one last question that really stuck with me. And it was about Dr. Kaczynski's overall philosophy on integrating lasers into dentistry. He's clearly so passionate about it.
Yeah.
And I'm curious to know, what drives that passion?
What's interesting is he doesn't just talk about lasers in terms of clinical outcomes
Yeah.
or making things more efficient.
Right.
He actually talks about how they've allowed him to build stronger relationships with his patients.
Oh, wow.
He feels like he can offer them a level of care that he couldn't before.
That is really inspiring.
Mhm.
And it's a good reminder, I think, that, technology is just a tool,
Mhm.
right? It's how we use it that makes a real difference.
Dr. Graber actually sums it up beautifully as one of the webinar. He congratulates Dr. Kaczynski on setting a new record for AMD Lasers webinars, which, speaks volumes about his engaging presentation style
Yeah.
and the incredible interest in diode lasers.
Yeah, it's clear that he's a leader in the field and he's inspiring others to really embrace this technology and, elevate the standard of care that we can provide for our patients.
Yeah, his enthusiasm is contagious.
It really is. So what does this all mean for you, our listeners? Well, based on everything we've talked about today, one thing's clear. Diode lasers are game changers in dentistry.
They really are. Powerful tools that can transform your practice and, most importantly, improve patient care.
Absolutely. So as you move forward, consider how you might use diode lasers to achieve those same amazing results we discussed. This deep dive has given you the foundation. Now it's time to take action.
Keep exploring, keep learning, and keep diving deep into the latest advancements in dentistry.
And we'll see you on the next deep dive.